Hi, this presentation is about chronic obstructive pulmonary disease. It's by myself, Dee Dee Love, Amber Olson, Mary French, and Priscilla Lazar. COPD is the third largest cause of death in the United States. 15 million Americans have been diagnosed. In 2011, 7.9% of Floridians were diagnosed, yet millions more go undiagnosed every year. That is because most people don't realize that they have COPD until something serious happens and they end up in the hospital. So what is COPD? Well, it's a group of chronic respiratory disorders. There's several that are included. They all cause a degeneration of the lung tissue and obstruction of the airway. COPD can eventually lead to respiratory failure from severe hypoxia or hypercapnia. So how do you know if you're at risk for COPD? Well, there are several risk factors. If you're over the age of 40, that's a big one. Having symptoms of COPD, that would be coughing a lot with no medical reason. It would also include difficulty breathing or shortness of breath, and you may or may not have mucus. The cough and problems that just don't go away. You definitely want to see your doctor about it. A history of smoking is another risk factor. That's a big one. That's what our patient today in our case study has, a history of smoking. And exposure to pollutants. A lot of people who've worked in factories with dangerous chemicals or with small fibers that they've breathed in, is another large risk factor. So our patient has a history of smoking. So most smokers develop emphysema, which is one of the chronic respiratory disorders grouped under COPD. So what is emphysema? Emphysema is caused by enzymes released during the inflammation process. The inflammation process releases these enzymes which cause a deterioration of the alveolar sacs, or the walls and the septae, by breaking down the elastic fibers in those sacs. I like to describe it like a pair of old underwear when they've just been stretched out of place and they won't go back into shape. When your lungs have been stretched out of place, you can't squeeze the air back out of your lungs. You can get it in, but it won't go out. This definitely affects your ability to take in enough oxygen. This process leads to large, permanently overinflated air sacs in your lungs, and this is a big problem. The result is loss of surface area decreases your gas exchange. It's a loss in gas exchange. Also, fewer capillaries for diffusion and perfusion. A loss of elasticity, like we talked about, like the stretched out underwear, and altered ventilation perfusion ratio. Now, this is the ratio of the air coming into your lungs versus the oxygenated blood going out to your body. It definitely affects that ratio, and this can cause a big problem. Patient history. Now we get down to our patient. Patient X is a 70-year-old white Native New Yorker of Irish descent. He's been retired for 10 years now and currently resides in Jacksonville, Florida. He's a former smoker who's recently quit after his diagnosis of COPD. He lives with his wife, has 3 grown children. He was very physically active up until about a year ago when he had to go on continuous home oxygen therapy. His wife has reported that he's been very depressed ever since then. His medical history. He has a little bit of mild obesity now that he hasn't been as physically active, some hypertension, hypercholesterolemia, chronic bronchitis. He's getting infections in his lungs because he can't get out a lot of the fluid. COPD, arthritis, sleep apnea, and depression. He's fully alert and oriented. He requires continuous oxygen therapy. He wears a CPAP machine at night. He's recently gone to need a walker for ambulation because of his shortness of breath, but he's still been competent so far in his activities of daily living. The home medication that he takes: Pulmicort, which is an inhaled steroid; albuterol, which is bronchodilator; lisinopril, Lipitor, Tramadol for pain, for his arthritis pain; Restoril, and Effexor for depression. So patient X retired early to bed one evening. He was very, very tired, but his wife reported that he coughed all night long and had sporadic sleep. When he woke up the next morning, he was extremely lethargic, and she noticed that his lips were turning blue. So she called 911 immediately. When the emergency services got there, they discovered that he had a respiratory rate of 32, and his oxygen saturation was only 75. He was taken to the nearest emergency room for treatment.